Good morning. My name is Diego, and I currently work as a medical scribe at both a local emergency department and an endocrinologist's office. After earning my undergraduate degree in biology, I decided to pursue a career in the medical field while preparing to take the MCAT and apply to schools. As part of this journey, I explored a range of positions, including primary care assistant, EKG monitor technician, and patient care coordinator. Ultimately, I chose to become a medical scribe, as the decision was inspired by my cousin, who was a scribe and is currently in medical school. When I asked him how best to prepare for this role, he recommended enrolling into ACMSO Scribe Training program as he did. Following his advice, I enrolled in the program and successfully completed it within a few weeks. The online format of the course itself was particularly helpful, allowing me to progress at my own pace and access materials from literally anywhere, even while traveling. I remember back when I was taking the course, I decided to go to Miami, and I was able to successfully complete modules during that time. This flexibility made it easier to balance the coursework with my other responsibilities and commitments, like studying for the MCAT. Two key skills I gained during the program stand out as being particularly impactful. The first is the ability to write detailed and concise histories of present illness, or HPIs. As many of you know, HPIs are a critical component of medical documentation, as they essentially narrate the patient's story, describing why they sought care in the first place, how they're currently feeling, and the events that led up to the encounter. Crafting a well-written HPI is essential, as it provides the foundation for effective patient care and communication among healthcare providers. The second skill I developed is the ability to parse out non-pertinent information. Patients often overshare a great deal of detail, but not all of it is as relevant to their current medical visit. Learning to filter and focus on the most critical information ensures the documentation is clear, concise, and actionable for healthcare professionals who may reference the notes later. The program also provided invaluable training in medical terminology, particularly abbreviations. Scribes we were taught with gathering as much pertinent information as possible, often under tight time constraints. Typically, typing quickly and efficiently is important, but the strategic use of abbreviations, such as PNA for pneumonia, HEN for hypertension, significantly enhances speed and accuracy. Memorizing medical abbreviations along with general lab values and anatomical terms was a game changer for me, boosting my confidence in the role. I cannot stress how important knowing these abbreviations are. Um, I remember during my first few weeks, I tried spelling out like pneumonia, hypertension, hyperlipidemia, but it oftentimes caused me to be behind on notes, and I take longer than needed. So as soon as I started using abbreviations, my speed increased dramatically uh, in terms of completing notes. Another strength of the ACMSO program is its focus on electronic health records, or EHR for short, particularly Epic and Cerner. Having started my career using Cerner, I initially found transitioning to Epic challenging. While the program's instructional videos were helpful, I believe offering a hands-on experience with a sandbox version of these systems would be an excellent addition to the course. Practical interactive training would better prepare future students for real-world scenarios. In short, the videos did help, but getting the hands-on experience, like while working, um, improved my speed and efficiency working in said systems a lot. Um, just like it doesn't even have to be Epic or Cerner, like just like some sort of general uh, EHR system that would allow people to actually like practice on them would be amazing. The course also helped broaden my understanding of different medical specialties. Through the program's 9 or so specialty certifications, I gained valuable insight into areas like cardiology, hematology, gastroenterology, and endocrinology, which I had some familiarity with from my college anatomy and physiology courses. However, I gained entirely new knowledge in specialties such as psychiatry and orthopedic podiatry, which were less familiar to me. This well-rounded education has been instrumental in my success as a scribe. Completing the ACMSO certification program has opened significant career opportunities for me. Initially, I secured a position working with a provider at a local emergency department. After a few months, word of my work spread, and I was invited to scribe for 8 additional providers across 2 other hospitals within the same healthcare system. My 6-month mark, I had the opportunity to expand my experience further by working 2 days a week with an endocrinologist at their private practice. Since then, I've been able to train a variety of scribes using both Epic and Cerner. Specifically at the emergency department, we use Cerner, and in the endocrinologist office, we use Epic. Now, 14 months into my scribing career, I feel incredibly grateful for opportunities this program has afforded me. I plan to continue scribing for another 4 to 6 months as I finalize my school applications. Looking back, I can confidently say that enrolling in the ACMSO program was one of the best decisions I've made, providing me with the knowledge, skills, and confidence to thrive in this role and advance my career aspirations. For anyone considering an entry-level position in the medical field, or looking to strengthen their clinical experience, I wholeheartedly recommend this program. It's an investment that not only prepares you for responsibilities of the role, but also opens doors to meaningful and impactful opportunities in healthcare. One thing I didn't talk about, but I really would like to, is your to future students, just for reference, if any of them are ever going to see this, um, learning to tailor each provider like has their own preferences for their own notes. Having dot phrases in systems like Cerner and Epic like help immensely. I mean, they save so much time, but knowing, working with each provider and learning their preferences. Do they like more detailed notes, less detailed notes? How do they like their physical exams written down? ROS. Um, do they like you to document uh, every time you walk in a room with them to see a patient? Do they like you to document any consultations they've had with any other providers? Um, it sounds like a lot, I understand, but it gets so much easier with time. I remember my first week, I was like, I was really scared because I was working. The first patient I saw on my first day was a code, and I mean I feel like that really helped me become less nervous, because there's really few things worse than that. Um, but ultimately, I know I'm rambling here, but learning how to cater, because the providers are the clients. Um, so we're there to help them to make life easier for them. Um, Knowing what type of notes to open is crucial as well. If there's a PA involved, if there's no PA, um, what do they like for their own attestations? Um, do they like do they document their own EKGs, or do they prefer that we document them? What else? I'm trying to figure out all information that would help future scribes, but it's just learning how to tailor your uh, your notes to each doctor preferences is the biggest skill but I feel like you can only learn that on the job. Uh, doing through via a course is difficult, but you'll get the hang of it. I know I did. If anyone can do it, if I can do it, anyone can do it. But that's it. Thank you for your time and have a great day.